Hello, my name is Muhammad Arif bin Sohaili. My case for radionuclide imaging is NM01. Patient is 45 years old female with diabetes mellitus and end-stage renal disease. Presented with rising serum creatinine 2 months after receiving a cadaveric renal transplant. The post-operative course was complicated by febrile neutropenia, which is a development of fever due to low number of neutrophil granulocyte white blood cell. Multiple biopsies of the transplant kidney show moderate severe acute tubular necrosis but no evidence of rejection. Multiple CT examination of pelvis show a stable 8.1 times 3.4 accumulation of fluid adjacent to the transplant kidney. Then she was referred to nuclear imaging department for further evaluation. The patient need to do a renal scintigraphy. Patient preparation before examination are as follows. The patient needs to drink plenty of water so that gamma camera can take images fluid collection in kidney and discharge through ureter and into bladder. Radiation technologists have to make sure the name and patient ID is correct. Patient have to sign the consent form. The height and weight have to be measured. Then set IV line for radiopharmaceutical administration. Ask patient to remove any metallic object such as hairpins, earring and glasses. Ask patient to change to hospital gown, and then radiation technologists have to explain procedure briefly and give a clear instruction. During examination, radiation technologists need to check on CCTV for patient safety. Always communicate to patient with easy language. Ask patient to urinate at the end of the scan. After the examination is done, remove the IV line from patient and then advise the patient to drink plenty of water to stay hydrated. The scan protocol is renal scintigraphy or renal scan. The patient positioning is supine. There are two radiopharmaceutical agents suitable for renal scan which are TC99M DTPA and TC99M MAG3. Because of the higher extraction efficiency, TC99M MAG3 may be preferred over TC99M DTPA, especially in patients with decreased renal function. There are three phases for renal scintigraphy. The first one is vascular phase. The second one is parenchymal or function phase. Third one is washout or excretory phase. We will discuss about the imaging phase later. The modality suitable for this scan is SPECT or SPECT CT. Vascular phase is performed immediately 5 seconds after the administration of radiopharmaceutical. This scan shows a transit of radiotracer through the blood vessel. Then parenchymal phase is performed 2 to 3 minutes after the administration of radiopharmaceutical. This is the period in which the nephrons extract the tracer from the blood and are excreted by glomerular filtration or tubular secretion. Then, washout phase is performed usually 20 to 30 minutes after the administration of radiopharmaceutical. This is the period during which the tracer drains through the renal pelvis into to the bladder. Moving on to the clinical reasoning. Several complications can occur after transplantation and may result in impaired renal function. The complication can be surgical complication or medical complication. For surgical complication, include renal artery thrombosis or stenosis, renal vein thrombosis, and urinary leak. For medical complication, includes organ or tissue rejection, drug toxicity, acute tubular necrosis ATN, transplantation-related malignancy, and also infection. The most complication of kidney transplant is allograft dysfunction or dysfunction of the transplanted kidney. The symptoms include acute rise in serum creatinine, decreased urine production, increased blood pressure, pyuria or white blood cell in urine, and proteinuria or protein in the urine. Renal scintigraphy has been used to assess the structure, blood flow, and function of kidney. With nuclear imaging, the radiolabeled isotope permits the mapping of blood flow through the kidney. This allows the imaging of blood flow obstruction or leak in newly transplanted kidney.